Hello, my name is Dr. Lane Robson. I'm a pediatrician and a pediatric kidney and bladder specialist. I've been working as a doctor helping families for almost 50 years. Yep, I'm that old. For the last 20 years, I've devoted my practice exclusively to helping families with children who have day and nighttime wetting. When you focus on such a small area for a long time, you'll learn a thing or two. I hope these videos help families that have children with day and nighttime wetting. Thank you. Hello, my name is Dr. Lane Robson. The question that I'm going to address today is, why do children deny they need to pee while they are doing the pee-pee dance? It's a pretty common scenario in my clinic. A parent arrives with a child who has a daytime wetting problem. The parent regularly sees the child holding the pee to the last minute, and then they run to the bathroom and they wet before they make it. The parent starts to remind the child to go pee when they see the posturing. The parent sees the posturing and says, "Hey, buddy, time for you to go pee." And the child says, "I don't need to pee." And they say it with a straight face. Now, some parents presume their child is lying, and some parents wonder if perhaps the child isn't getting the nerve signal from the bladder to the brain. It's a very frustrating situation for parents and for the child. The parent wants the child to go pee to avoid a wetting episode, and so they encourage the child to pee, and the child says, "No, I don't need to pee." And if not handled properly, carefully, this can dissolve into a confrontation. "Please go pee. I don't want to pee. You have to go pee. I don't want to go pee." It dissolves into a fight. So what really is happening when the child denies they need to pee while they're doing the pee-pee dance? Well, for sure the brain is getting the signal. The full bladder signal goes up the spinal cord to the brain, and the brain initiates the motor response, which is the pee-pee dance. There's no doubt that the signal is getting up to the brain. However, the signal ultimately is going to travel to the frontal lobes. That's where executive decisions are made. And the preferred executive decision in this scenario is that the child gets the signal that says the bladder is full, stops the compelling play activity, and goes to the bathroom. However, the compelling play activity and everything else that's going around along in their very busy environment are all signals that are coming into the frontal lobe at the same time as the signal of a full bladder. Now, 75% of all the children in my clinic hold the pee past full, posture, run, and have daytime dampness or wetting. So it's pretty common. In these children, they've been holding the pee past full with compelling play activities for so long, so often, that the signals fade away like background noise. Now, we all understand the phenomenon of background noise. That's noise that's in our environment, that's there and that our brain registers, but we don't hear. We don't hear because conveniently the frontal lobes allowed that sound to disappear so that we, the adults, could pay attention to the more compelling activities in our environment. Same thing happens with the signal of a bladder pressure in a child who's posturing. The signals have faded away like background noise. Think of this as a multitasking challenge. There's lots of adults that don't multitask very well. Well, preschool and early elementary children certainly have some challenges with multitasking. So the child is receiving the signals. They've just lost touch with the signals. They've faded away, much like background noise. The child is not lying. They shouldn't be punished. There's no role for confrontation. The parent needs to find a way to finesse the cooperation of the child to stop what they're doing and go pee without a confrontation. So, that's why children deny they need to pee while they're doing the pee-pee dance. Thank you. I hope you enjoyed the video. For further information in a readable format, please consider purchasing my book, How to Cure Bedwetting, packed with useful information to help families lead their child to dryness. Thank you. Have a great day.